Hello, I'm student physician Elizabeth Stoll, and I invite you to join me today as we meet our first patient and talk through what a journey to restore wellness looks like. Meet Jack. He is 19 years old and identifies as male. Already there are many things we don't know about Jack. What ethnicity is he, and will this create any educational or language barriers? What are his religious beliefs? How does this affect how he lives his life? And what is his constitution, as this will affect both our communication as well as our treatment strategies. Jack comes in today with a chief complaint of recurrent diarrhea and muscle aches, although we are unsure of what recurrent means. He states he just returned from a cruise with his family to the Eastern Caribbean, but we are unsure of what just means, as days, months, or weeks would affect our analysis of the chief complaint. He is febrile, complains of a mild but annoying cough, and was spotted by a receptionist gingerly taking off his jacket, indicating a red raised tattoo that could either be infected or new. Upon looking at his past medical history, we see Jack has asthma that is controlled by Flovent, a corticosteroid, but we are unsure of the dose or usage of this medication. He has recently finished his GED and is celebrating 1 year of being sober. It is very important that we do not assume what sober means, as it can either indicate drugs or alcohol. Instead, it is our job to investigate and get the full picture of Jack's history in order to ensure the best differential diagnosis. There are several things I would like to discuss with Jack, including where he went in the Caribbean, what he did when he was on his cruise, where he got his tattoo, is he up to date on vaccinations, his lifestyle, his eating habits, and his past medical history. I would also like to perform an osteopathic and physical exam in order to get the best full-bodied view of what is going on in order to better choose a differential diagnosis. Based on the information we have currently, I chose 5 differential diagnoses, 4 of which were infectious, but I would like to talk about why I narrowed each of those out. Dengue fever, although it fits his current symptoms, does typically present with a rash, which Jack did not. Histoplasmosis is 99% asymptomatic, and I would have expected something in his history concerning bat or bird droppings, such as cave dwelling. Leptospirosis has a hallmark symptom of conjunctival suffusion, which I would have seen during Jack's physical exam. And enterotoxigenic E. coli, also known as traveler's diarrhea, affects mucosal osmolality and should not produce a fever. Therefore, based on the story that Jack gave us, as well as his symptoms, I believe the best differential diagnosis is acute hepatitis C, which we'll explore further. The CDC has 2 guidelines for acute hepatitis C. The first is an acute illness with discrete symptoms, in which Jack's fever, myalgia, and diarrhea fit, although diarrhea is less common. The second guideline is something we would observe clinically and test for. The most important thing is Jack's story, because this has greatly increased his risk, since he has recently traveled, potentially received an unsterile tattoo, and has a history of substance use. What does not fit Jack's diagnosis is his cough, although he does have a history of asthma, and I would like to further question his compliance with his medication during travel. It is important that we stop and pause at this moment in order to consider the ethical concerns associated with a stigmatized diagnosis like hepatitis C. I do not want Jack to think, I'm assuming, as some do, that this is a disease of prisoners or IV drug users. Hopefully at this point I have cultivated a caring enough environment so Jack knows that our goal is to get to the root cause of the problem in order to restore his wellness. I would warn him there are some tough and uncomfortable questions I am going to be asking, but the more honest he can be, the more successful the treatment will be. I'd like to talk with Jack about the common routes of potential transmission for hepatitis C so we can begin to understand where his risks and potential transmission come from. Unfortunately, worldwide, there's an alarming number of drug users who do not know they have hepatitis C. I would like to ask Jack if he has recently or in the past used any injection or IV drugs. Additionally, if he's used any drugs that involve sharing instruments, as intranasal drugs such as cocaine and heroin can transmit hepatitis through mucosal membranes. I would also like to question his occupation, because a needle stick injury can result in transmission as well. I would also like to talk with Jack about where he got his tattoo. and try to be as sensitive as possible, explaining I understand that he did not potentially know the risks of getting tattoo in an unsterile environment. 13% of patients in the U.S. have reported exposure and contraction of hepatitis C through this route. I would also like to get a good sexual history on Jack. A colleague from Denver Health has created this flow chart in order to understand the details with sensitivity, since gender is on a spectrum and sexuality and sexual practices can be very diverse. I would like to discuss these with Jack because hepatitis C transmission is much higher in men who have sex with men and has a lower incidence in heterosexual behaviors. I would also like to discuss this because HIV is a known common co-infection with a very serious diagnosis. After explaining transmission with Jack, I would like to talk about how serious the diagnosis is. Not only are there various genotypes, but it can also result in some very serious end-stage disease. Acute hepatitis C lasts for 6 months. 50 to 80% of patients will progress to chronic, and of those, 20% will develop cirrhosis, and an additional small population will develop end-stage liver disease and hepatocellular carcinoma. There is a chance also of spontaneous resolution, which we will discuss in treatment options. Once Jack has a thorough understanding of the disease, I would like to test him. I would like to look at HCV RNA via PCR in order for early detection because it does take some time for antibodies to develop. I would also like to test for these anti-HCV antibodies, though, in case Jack has had this infection for longer than we are predicting. In addition, I would like to get a complete metabolic panel, which shows ALT and liver damage, because HCV has a characteristic polyphasic pattern. If my differential diagnosis is correct, I expect to see him somewhere along this graph. I would also like to use these values as a baseline so we can see how things change in the future. At this point, I would like to invite Jack to be an active part of his treatment, especially because we have 2 big options. 1, we can use immediate treatment, or 2, watchful waiting, and I must discuss the risk and benefits of both. Direct-acting antivirals have proven to be very effective, as we will discuss shortly, but so has spontaneous clearance. One study has shown that 91% clearance has been noted with delayed treatment, and this includes both those who spontaneously cleared as well as those who received treatment after watchful waiting for 12 weeks. This shows that 44% of patients avoided unnecessary treatment without worsening the end treatment outcome. I would like to talk to Jack additionally about his goals, concerns, and lifestyle. Based on our visit, if Jack believes there is any chance of transmitting HCV to someone else, I would like to start treatment immediately. I would also like to analyze Jack's potential risky behaviors to make the best choice for him. Recently, the treatment of hepatitis C has become both a social justice and public health issue. New direct-acting antiviral drugs, such as Harvoni, shown in the top right corner, are now being shown as a cure. Genotype 1 is the hardest to treat and also one of the most common, and this drug is showing a 97% cure rate. In the past, hepatitis C was treated with interferon, and there was very, very severe side effects, as well as a treatment plan that lasted up to 12 months. Because of this, there was limited access and discrimination against those who would not comply. Presently, there is a different social issue. The cost of the drug is up to $94,000 for a 12-week treatment. There has been many insurance companies who refuse to offer this drug, as well as Medicare, who states they could give 25 people insurance for an entire year for the cost of treatment for one patient. We are now seeing states restricting these drugs based on the budget they have for healthcare. Because of this, I would like to encourage Jack to participate in watchful waiting with testing every 4 weeks. If he agrees, I would like to start Jack on milk thistle, which is a very safe herb that supports the liver by acting as an antioxidant, hepatocyte stabilizer, and potent anti-inflammatory. If he does not spontaneously clear after 12 weeks, I would like Jack to work with a specialist, since there are 6 genotypes, many subtypes, and many different combinations of medication that can be recommended. I would like to finish our discussion especially focusing on wellness. How do we decrease toxins to the liver? I would like Jack to avoid drugs, alcohol, and highly processed foods, as well as discuss those laden heavily with pesticides and herbicides. I would like Jack to focus on high antioxidant, fresh fruits, vegetables, as well as clean meats. I would also like to discuss transmission because it is very important that HCV be prevented from being transmitted to other individuals. I would encourage Jack to get both a hepatitis A and B vaccine if he is not up to date as well. If Jack at any point notices symptoms worsening, I would like him to call and return immediately. Hepatitis C is a very fascinating and social issue that everyone should be aware of, and I would like to encourage further education with any of these sources. I would like to also say thank you to all of the physicians and faculty that helped me with this presentation in my PTA group, as well as Dr. Ambler, and leave student physicians with a final thought. I encourage you to look at the whole person. I invite them to be part of their treatment and their wellness. This is both, and many treatments are, both an ethical and social issue, and it is important that we try to begin to understand the issues associated with the diagnoses and treatments that we are offering. Thank you.